Hi, my name is Lexi Lehan, and I'm the Aftercare and Alumni Supervisor here at Lakeview Health. Thank you so much for joining us for our first webinar in our family webinar series. Tonight, the topic is understanding addiction as a disease. We're so excited to have Debbie Fiegel here with us tonight. She is going to be your presenter, and Debbie has been working as a PA for over 30 years. She's worked with a focus on addiction medicine for the past 8 years, and previously, before she worked here at Lakeview, she worked at the Mayo Clinic. So without further ado, I present with you Debbie Fiegel.
Thank you, Lexi. And as Lexi mentioned, we're going to be talking about how to understand addiction as an organic brain disease because it's very important to understand that. It helps to, when understanding that, to understand why our family and our loved ones who are addicted act the way they do and why recovery can be so difficult. So during this lecture, we're going to meet several objectives. We're going to define substance use disorder, also known as addiction in the old parlance. We're going to understand the disease model of addiction and the reward pathway in the brain that is responsible for addiction and addictive behaviors. We'll also discuss the genetics of addiction, nature versus nurture, how 12-step support groups relate to the brain disease of addiction, and some of the things we can do to what to expect when our loved ones come home. I do not have any financial disclosures. So the American Society of Addiction Medicine defines addiction in a certain way. Addiction is a chronic disease of the brain, and it involves dysfunction in memory, reward, motivation. The hallmark of addiction is that the addicted individual pathologically pursues reward, the reward being the high or the euphoria caused by the drug or alcohol, or relief by the substance of use. Relief, in this sense, can be relief from physical, emotional, or spiritual pain. By pathological, I mean that use of the substance continues despite negative consequences. Addicted individuals cannot consistently abstain from using due to impairments of behavioral control, the phenomenon of craving, and diminished recognition of the significant problems often caused by substance abuse. Addiction is a chronic disease like any other. High blood pressure, asthma, and diabetes are chronic diseases that can be managed using lifestyle changes and medication. Addiction involves cycles of relapse and remission, and in fact, relapse rates for chronic diseases such as high blood pressure and asthma are similar to those for addiction. The difference is that addiction is perceived as a disease of choice. When a previously well-managed diabetic comes to clinic with out-of-control blood sugars, we don't treat them like they are failures. However, relapse and addiction is often treated that way. Addiction is a progressive illness that, when untreated, often results in significant disability and or death. The Big Book of AA states that untreated alcoholism has only 3 outcomes: jails, institutions, and death. In 2017, 18.7 million people age 18 and older had a diagnosed substance use disorder or addiction, or about 8% of the U.S. population. This statistic does not include undiagnosed addiction, so the number is likely more in the 10 to 12% range. Of those diagnosed, 75% struggle with alcohol, 36% illicit drugs, and about 11% struggle with both. Almost 19% of the American population is diagnosed with mental illness, and of those diagnosed, 25% have a substance use disorder. This translates into about 4% of the population, or approximately 8.5 million people with both mental illness and substance use disorders. As I stated, these numbers are likely low, as addiction and mental health problems are still underreported and unfortunately undertreated in the United States. In 2017, more than 72,000 Americans died of drug overdoses, mostly opiate related. For 2018, that result is probably going to be higher. By contrast, there were 40,000 vehicular deaths and about 80,000 deaths from diabetes. In my prior career as a specialist in breast diseases and breast cancer, I often lectured on breast cancer rates in this country. Today, fewer than 40,000 women die of breast cancer every year, and that number continues to decrease. In 2017, almost 90,000 people died as a direct result of alcoholism. A woman diagnosed with breast cancer today has between a 90 to 95% chance of being completely cured of their cancer, whereas someone diagnosed with alcoholism today has up to a 90% chance of actually dying of that alcoholism. It doesn't take much to contrast the two diseases. Breast cancer has a huge lobbying platform with many organizations raising money, awareness, and government grants for research, and contrast that with addiction treatment lobbying and research grants, which lag far, far behind. Addiction is an organic brain disease. Understanding the brain structure is an important step in understanding addiction. The brain is composed of billions of neurons and trillions of supporting cells. Neurons are the cells of the brain that pass electrical signals along pathways that allow communication between all parts of the brain, similar to insulated electrical wire. The neurons are not continuous, however, and there are small gaps between each cell. The gaps are called synapses. Electrical signals pass along a neuron that cannot pass the synapse. To pass the electrical signal, the neuron must convert that signal to a chemical messenger that passes across that gap, and then the signal is regenerated in the next cell and continues on. And I have some slides to demonstrate that. The chemicals responsible for this are known as neurotransmitters. So this is a slide that represents a picture of two neurons, two nerve cells in the brain. And the soma is the main body of the cell, and the dendrites and the axons are those branches which connect to other nerve cells. The terminal is also called the synapse. There are multiple neurotransmitters in the brain. Many of them are active and play a role in addiction, however, are also responsible for a myriad of other brain functions. For the sake of simplification, the main neurotransmitter we will discuss will be dopamine. Some of the neurotransmitters common in addiction are listed. I think it's important to note that the second neurotransmitter listed, serotonin, is also a chemical commonly manipulated for the treatment of depression. SSRIs, or selective serotonin reuptake inhibitors, such as Prozac or Zoloft, are often used in the treatment of depression. As we've already seen, addiction and mental health disorders go hand in hand and can often present a complicated picture. This slide illustrates the synapse between neurons. The small black dots to the right represent the neurotransmitter being released into the synapse. Here's a closer view of a synapse, and we see dopamine in the far part, the part of the neuron that's going to send the electrical message. Neurotransmitters operate in a lock and key fashion. Dopamine within the cell is released into the gap and fits or binds to a receptor on the next cell. This causes the electrical signal to be reconstituted in the receiving cell. The character of the signal can be affected by the amount of dopamine released, the number of receptors on the opposite cell, or how long the neurotransmitter remains in the gap. Drugs of abuse or any mood-altering substances affect what takes place at the synapse between neurons. Drugs of abuse can mimic, increase, decrease, or prevent reuptake, which means keeps the substance in the gap longer, of neurotransmitters. Examples of what neurotransmitters are affected by what substance are listed. For instance, opioids such as heroin or pain medication increase the amount of dopamine released at the synapse, as do amphetamines, cocaine, and alcohol. THC, or the active mood-altering ingredient of marijuana, mimics a naturally occurring neurotransmitter called anandamide. THC fools the brain into thinking there is much more of the neurotransmitter at the synapse therefore amplifying the chemical signal. And in the slides, you can see the similarity of the two molecular compounds. Addiction takes place in a primitive part of the brain called the pleasure-reward pathway. During development in the womb, the human brain develops from back to front. The first part of the brain that develops is the brainstem, which is responsible for automatic functions such as breathing, heart rate, and blood pressure. And that's represented to the right of the screen. The midbrain is the second part of the brain to develop, and within the midbrain is the pleasure-reward pathway. The pleasure-reward pathway often is referred to as the lizard or reptile brain and is responsible for keeping humans or mammals or reptiles alive as a species so that their genetic material can be passed down to successive generations, ensuring survival. The brain rewards us by providing a dopamine or pleasure sensation surge for activities that are meant to keep us alive. That's why food and sex are pleasurable. That feeling that we get when we hug a loved one, that warm, tingly feeling, that is a surge of dopamine that entices us to stay together as a community and to nurture our children. So the pleasure-reward pathway exists so that activities such as eating, having sex, nurturing our children, sleeping, and socializing are pleasurable. Each activity provides pleasure so that the activity is repeated. Also in the midbrain is the limbic system, which is responsible for risk-taking, emotions, impulsivity, learning, and memory. The prefrontal cortex, or thinking cap, I like to call it, is the last part of the brain to develop. The prefrontal cortex is where higher-ordered thinking occurs, such as decision-making, impulse control, judgment, planning, and coping skills. This part of the brain does not fully develop until about the age of 25, and because it develops last, it has limited control over the functions of the midbrain. The reason that there is not much conscious control over the pleasure-reward pathway is because if we were to stop doing things such as eating and having sex or nurturing our young, we would no longer be able to pass on our genetic material and survive as a species. As an example of how strong the drive for survival is, think of the Donner Party, a group of Mormons that became stranded in the Sierra Nevada mountains during winter in the 1800s, or the South American rugby team who became stranded in the Andes after a plane crash. We all know that cannibalism is morally repugnant. However, when faced with starvation, these two groups of people cannibalize their dead to survive. People are known to kill to protect their children, and for those who read the news, people kill each other over sex every day. Killing another person is also something the rational mind doesn't do. So in a sense, the midbrain is able to hijack the prefrontal cortex, or the thinking cap, to get what it needs to survive. The problem in addiction is that alcohol and drugs of abuse interfere with the pleasure-reward pathway. Drugs and alcohol cause rapid and dramatic release of dopamine, among many other neurotransmitters, that directly and intensely activate the pleasure-reward pathway. This jolt of intense pleasure leads to repeated use and, over time, less pleasure for natural rewards. This is why people in active addiction find less pleasure in food and family. They tend to isolate, and things that once brought pleasure to them no longer do. This is another illustration of the reward pathway in the brain. The VTA, or ventral tegmental area on the right, that's the blue spot on the right, is responsible for dopamine production. The nucleus accumbens is the small dot on the left in the midbrain, is stimulated by dopamine and responsible for motivation and goal-directed behavior. This is what allows pleasurable activities or drugs to stamp in memory and provide the motivation to repeat the pleasurable experience that the drug provides. In addition, the substance of abuse begins to be interpreted by the pleasure-reward pathway, or the midbrain, as necessary for survival. Just as in starvation, moral thinking is hijacked. Hijacked to obtain food. It is also hijacked to continue access of the substance of abuse. This is why an addictive individual may become deceitful, taking dangerous risks, or even pursuing criminal activities to obtain their drug of choice. I'm often asked if this pathological pursuit or hijacking of morality that takes place in addiction is an excuse for bad behavior. The answer is no. It's not an excuse. We are always responsible for our behavior. The Donner Party was still responsible for the fact that they cannibalized their dead. It is an explanation, however, for why addicted people act the way they do. Any person who goes against what they consider their own moral code of what is right and wrong is aware of doing it and is responsible for their actions. The fact that the addict is aware of what they are doing is wrong creates shame, and shame is a strong driver for perpetuating the disease of addiction. The slide illustrates in green the pathological pursuit of reward with the preoccupation and anticipation of getting the drug in the prefrontal cortex. Once the drug is obtained and used, intoxication and euphoria occurs. Once the euphoria is worn off, the realization of all the negative effects set in, which leads to shame. Relief of the shame and negative consequences is then sought, starting the cycle over. This slide illustrates structural changes in the brain of a cocaine addict. We know that prolonged drug and alcohol abuse leads to sometimes permanent structural and functional changes in the brain. On the left is a normal brain with the yellow and red areas indicating high activity that takes place when someone is thinking or working. Following significant stimulation of cocaine, the dopamine response is significantly decreased, and at 1 week it is obvious that brain activity is drastically reduced, and even at 3 months on the right has not returned to normal. This is just a slide and a word about prescription drugs of abuse, that just because an opiate prescribed for pain or a benzodiazepine such as Xanax prescribed for anxiety is taken as directed, it does not mean that addiction or withdrawal will not occur. So who is at risk for addiction? Is addiction caused by nature or by nurture? Well, there are multiple risk factors for the development of addiction, and this involves a complex interplay of genetics, the environment, and the drug itself. We know that genetics play an important part in addiction. Some studies suggest that there can be up to a 50% chance of developing addiction if your parents were addicted. At the same time, we also know that nurture plays an important role. Home and social environment are important, as well as developmental experiences such as trauma, abuse, neglect, and deprivation. More subtle developmental experiences also play a role. That is why the word perception is highlighted in red on this slide. Not every individual who has experienced trauma, abuse, or neglect develops addiction. How that developmental experience is perceived and interpreted and then processed is what is very important. For example, many of my patients will talk about experiences growing up that they perceive as being damaging. However, parents and family members will have a different or even completely opposite view of what has occurred. Perceptions are what are important and not necessarily the facts or who is right or who is wrong. Just as nature and nurture are important in the development of addiction, the drug, how it is used, and how often it is used plays a role. Other brain mechanisms such as mental health disorders or the genetic propensity for developing mental health disorders also plays a role. For example, all opiates or painkillers have the potential to be addictive. However, a pain pill swallowed is not as addictive as it would be if it were snorted or crushed and injected intravenously. Inhaled and intravenous drugs tend to be more quickly and devastatingly addictive than other forms of drug use. There are multiple other factors that play a role in vulnerability to addiction, including medical and psychiatric conditions, emotional and behavioral problems. People with learning or cognitive disorders may have a higher risk of addiction. As mentioned previously, mental health disorders and addiction are commonly seen together. We call these co-occurring disorders or dual diagnosis. In our practice at Lakeview, up to 85% of our patients have dual diagnosis. Some medical conditions, such as chronic pain, or psychiatric conditions, such as anxiety disorders, are associated with higher rates of addiction simply because medications used to treat these disorders are often highly addictive. These are examples of dual diagnosis or co-occurring mental health disorders we see in our patient population. And that includes depression, anxiety, attention deficit or hyperactivity disorders, mood disorders such as bipolar disorders, psychotic disorders such as schizophrenia, obsessive compulsive disorder, and post-traumatic stress disorder. This slide demonstrates the risk of addiction in co-occurring mental health disorders. Almost 50% of people with schizophrenia, 27% of people with major depressive disorder, and over 60% of people with bipolar I disorder are also diagnosed with addiction at some point in their lives. This is because the drive in the brain to manage mood. Due to the drive in the brain to manage mood. A person with an untreated mood disorder is much more likely to use mood-altering substances to manage their mood. For example, feel less depressed or less anxious. So what comes first? Do mental health disorders precede addiction, or does addiction cause mental health disorders? The answer is both, and it's complicated. As previously discussed, untreated mental health disorders put a patient at risk for addiction. However, addictive substances in their own right are mood-altering and often cause depression, anxiety, and mood swings. Some mental health disorders caused by drugs of addiction are not reversible but can be treated. Often depression, anxiety, and other mood problems may completely go away once drug and alcohol use has stopped. Quite alarmingly, a very good recent study in the Lancet out of Great Britain, a European and Brazilian study, demonstrated that chronic smoking of high-dose marijuana, which is high-dose THC marijuana or cannabis now, has led to a 5 times increase in diagnosis of psychotic illness such as schizophrenia in that study. Readiness to change is something that is evaluated once a person decides to come to treatment for addiction. Often the initial motivation is external, meaning that pressure is being exerted on the patient to get help, whether that be by loved ones, employment, or the legal system. Internal motivation is the patient's own desire to get help. Motivation depends on insight into the disease and that person's own addictive behaviors. Unfortunately, higher order thinking is affected by addiction, and therefore judgment is affected. And we often see rationalization, justification, and denial of addicted behavior. Few people will become internally motivated for recovery from addiction unless there are consequences to their ongoing behavior. As discussed previously, addiction is a disease of relapse and recovery. Certain factors increase the risk of relapse and decrease the chance of long-term recovery. Some of these are listed and include multiple failed previous addiction treatment attempts, previous overdoses, co-occurring psychiatric diagnoses and admissions, a high-risk lifestyle, trauma or abuse, legal problems, history of incarceration, and lack of resources in housing, financial resources, and things of that nature. So what to know? Recovery is a dynamic process, and what is important to know as a loved one is that medical detoxification from the drug of abuse is not treatment for addiction. By this I mean treatment of addiction involves changing thinking and changing attitudes, developing healthy coping mechanisms, and treatment of underlying medical and psychiatric disorders, and often undergoing behavioral therapy and support systems to maintain recovery. Recovery is not something that happens in a few days or really even a few months. Detoxification only involves safely removing the drug from a person's system. Almost always, the longer treatment is the better treatment. Treatment, in quotes, takes many different forms, including residential treatment, meaning living on site at the treatment center, which can last anywhere from 30 days to a year or longer. Intensive outpatient, sometimes we call that IOP, where a client can live off-site, usually requires coming to programming several days a week, which can last for weeks or months. Sober living is an environment where clients can live with other people recovering from addiction, which may or may not be associated with an IOP, particularly if there isn't adequate support for housing and financial assistance, or if coming home really isn't an option right in the beginning. 12-step recovery, such as NA or AA, and the steps of recovery provide a framework for ongoing behavior change and maintenance. So another thing to know is that denial in our loved ones is a very powerful process. Very few addictive individuals believe that they need treatment, and especially the treatment that's recommended. Manipulative behavior, expected, particularly to get out of staying in treatment. We often see things, and they're listed below, but patients come up with quite a few of them to justify why they don't need to stay in treatment. After treatment for addiction, no one is ever cured. Just like no one is ever cured from diabetes, it is something that is managed. All clients will have recommendations for ongoing care, including medical, psychiatric, psychotherapy, and mutual support groups such as AA and NA. So a word on the 12 steps of recovery that is associated with 12-step recovery groups like NA or AA. There are alternatives to 12-step based recovery programs such as Smart Recovery. However, outside of very large cities, daily non-12-step mutual support groups are not common, and daily support is necessary, if not essential, particularly in early recovery. A common misconception about 12-step support groups is that they are religious, although some, such as Celebrate Recovery, are. The principles are spiritual, but not religious in the organized religious sense. 12 steps provide a framework for change in thinking and behavior to maintain recovery with support of others that have been through the process. Recovery for both the addicted individual and the family is like climbing a mountain. The view from the top is spectacular. And recovery is not a straight line to the top. That's something that a lot of people believe happens, is that once we start recovering is steady and just keeps going forward. But unfortunately, that's not really how it is. It's more like a zigzag with ups and downs to be expected. The recovering individual must learn how to fit recovery activities into every day, which is overwhelming for that person, but also for loved ones who may expect them to spend more time at home attending to previously neglected relationships and tasks. Healing is a slow process, and expectations need to be curbed to account for this. If family become involved in their own recovery process, the transition tends to be smoother. Much like weight loss, we all know how to eat, control portion sizes, and exercise. Recovery is fairly simple. Follow the rules. But just like losing weight, recovery is not an easy process. And I want to spend just a word talking about Narcan nasal spray. An estimated 40% of opiate overdose deaths involve prescription opioids, such as pain pills. Narcan reverses the effect of opioids and allows an overdose person to breathe again. Most states do not require a prescription for this, and many insurance companies have coupons that will cover it at no cost. If your loved one has an opiate addiction or anyone in the home uses opiates, it's a good idea to have this on hand. Having it does not indicate distrust of a recovering loved one. Lakeview provides prescriptions for all patients, regardless of addiction type. And always to remember to call 911 if you use the Narcan. Thank you very much for your attention, and I believe we will be accepting questions at this point.